Hello everyone, this is our review for chapter 19, which is the dental lamina and the enamel organ. This needs a little bit of more focus. It's a little bit more interesting chapter than other ones. So let's just start a little bit by remembering the parts of the tooth that we have. So we have the enamel, right? That's the enamel layer. Because in this chapter, actually, we'll know how the tooth itself form. In the previous chapter, we knew how the face kind of form, what forms the face. And in this chapter, we'll know how the tooth form and how each one of the layers of the tooth would form. So this is the enamel, and this is the dentin, right? That's the dentin, and this is the pulp, and that's the bone that we have here. That's the gum. We have the cementum, which is surrounds the dentin and the root area, and we have also the periodontal ligaments here and there. Okay, so this technically explains everything that we're going to talk about in a way. So I wanted to have it here as the first picture, just to kind of give you a big picture, and then we'll go and talk about it. Technically, the way that the tooth would form, we'll have something called the dental lamina, and as you can see, this is the tongue, and this is the arch, and this is the lip. So it's just to give you some perspective. That's the lip, and that's the arch, the dental arch, before we have any teeth in it, and that's our tongue. So the way that it forms, we have something that called dental lamina, right? That's the dental lamina. The dental lamina will start to, which is the epithelium that we have here, will start to grow down. Okay. And that's in while the baby is a fetus, like inside of the womb, inside of the this again will start going down and would form a bud, something like a bud, like you see here. These buds would form the primary teeth. Okay, so they form each one of them, and a side of this bud would also form the permanent teeth. So the dental lamina would go down and then would form some buds for the primary teeth and buds for permanent teeth. And as you know, we have some molars that are non-succedaneous teeth, because they don't appear where primary teeth like appear. They would have their own buds. They will not be connected to that. Okay, and then these would form in different shapes and different stages that we'll talk about, and then they will start erupting up. But that's the whole, technically, the picture. And then in the same time, the dental lamina would have also another part of it. So you have this part, and then have another part that will form the vestibule. So this is I think this is again a good just overview of what we're going to talk about generally. Okay, dental lamina. So dental lamina is technically that surface here, so that the surface of the the oral cavity. So it's thickened oral epithelium, and this one would form the enamel organ, and this is what we say the enamel organ. Technically, the enamel organ is the one that will form the teeth in general. So it begins in the 6th embryonic week, and as we were saying, like, if a primary tooth did not erupt, the permanent will not erupt with it, because again they're connected together here. So this is just a side note. Okay, now dental lamina forms the enamel organ, right? So the enamel organ has 3 stages. It has a bud stage, and the first one, and then it continues, and then it will be the cap stage. So this would form this, and then it has the bell stage, and we're going to talk about each one of them. What are the cells that are differentiated? And as you can see, like, it starts just as a bud, and then it starts to kind of have some concavity in it, and then that's where the enamel or the tooth will start forming. See, like in the bell stage, you can see almost the crown of the tooth. And all of these cells that we see here, we'll get to know them, and we'll get to know which one they do. So be able to recognize the bud stage from these pictures, the cap stage, and the bell stage again from these pictures. These are all stages of the enamel organ. Okay, know the dental lamina definitely, and all these. Okay, so the first stage, which is the bud stage. So that's the initial one. right, from the dental lamina, and it's the first stage in the development of the enamel organ. We don't have a lot of here things to talk about the bud stage. Now let's move on to the cap stage. Okay, so in the cap stage we'll have 3 different layers of cells that will differentiate. Now before in the bud stage we cannot technically differentiate anything else, from everything else. We have some things, but here in the cap stage we have more differentiation. Okay, so we have 3 layers that will differentiate, cell layers. So you have stellate reticulum, you have the outer enamel epithelium, and you have the inner enamel epithelium. And almost from now on we'll start to call them OEE and IEE. Definitely on the test you want to mention the whole thing. Outer enamel epithelium, but I'm saying here in the PowerPoint. So as you can see, so the stellate reticulum is the one that is between the inner and outer enamel epithelium. So let's take a look. Where's the inner, where's the outer? This is the outer enamel epithelium. This picture, you need to recognize it and be able to know which one is which. And you can see this is the bud that we were just talking about. This is the oral epithelium and the dental lamina. That's where it started, right? The dental lamina grows down. So that's the dental lamina, and it formed the enamel organ. And now the enamel organ is in the cap stage, where now we have an outer layer and an inner layer. So outer enamel epithelium and the inner enamel epithelium. Between the outer and the inner, we have the stellate reticulum, right? So technically the stellate reticulum is just something cushioning, and it can also have some nutrition for the cells that will form the other things that we'll talk about. You can see that's the outer. So anything on the outs is the outer enamel epithelium, and anything inside here is the inner enamel epithelium. The outer enamel epithelium is just mainly a protective layer. Okay. Now the inner enamel epithelium is one that is interesting because it forms something. It forms the ameloblast cells. So these cells that you see here afterwards would form new type of cells, we call them ameloblast cells. And ameloblasts are the cells that will make the enamel. They will start depositing the enamel as they go up, and this would start keep moving up in this direction, and then keep forming. These would keep forming, going down from here and here to make a crown shape of the tooth. Okay, so the inner enamel epithelium is the one that will make the ameloplasts, and the ameloplasts would form the enamel. So once we get down more, up, or up more, whatever you want, however you want to call it, and the ameloblasts reach to the outer enamel epithelium, right? They'll go in and more, as we said, to make the crown. Once this gets close to the outer enamel epithelium, this will signal that the ameloblast should stop making more enamel, right? We got to the level that we're good now. Stop making enamel. Okay, just a mechanism that will control that thing. Also, the ameloblasts will blend with the outer enamel epithelium. So they'll get there, touch them, or reach to them, and they will stop enamel, doing the enamel, making the enamel, and then they will blend together, and they will make a new layer. We call it the reduced enamel epithelium. Technically, it will make something protective on the enamel, but we don't want to get to that. Just know the main things that we mentioned here. Okay, 3 layers: the outer enamel epithelium that will protect, the inner enamel epithelium that will make ameloplasts make enamel, and then the stellate reticulum that cushion. Ameloplasts are the ones that are made out of the inner enamel epithelium, and the ones that will make the enamel. Okay, so again, I can ask you where the ameloplasts come from inner or outer, or the stellate reticulum. You have to know. Or what makes the enamel, or where the enamel come from, or origin. Is it from the inner, the outer, or the stellate reticulum? Again, so things can go. You have to know what each one of these layers do. So now we're in the cap stage. The next stage to it is what? The bell stage. Before we go, you can see this is just a picture to show you in real life, like how it actually looked like. Anyway, but again, recognize the picture, be able to know the parts. We'll talk about successional lamina. Technically, this is the part that will make the permanent tooth. Remember, we said that one side will make the primary tooth and the other side will make the permanent tooth. In this first picture here, see, this is the successional lamina. That's what it is here. Successional lamina. Okay. So let's get to the third and last step of the enamel organ stages. The main difference here, you can see it almost looks the same. I mean, we're trying to make it simple, but the main difference is that a new fourth layer would appear, which is the stratum intermedium. The stratum intermedium is a layer that would appear between the stellate reticulum and the inner epithelium, enamel epithelium. Okay, what they will do, what the stratum intermedium do is to nourish the inner enamel epithelium layers. Okay, so that's, that is the main thing that we can differentiate between the bell. We will say that we got to the bell stage because their new layer appears. So if I ask you, if a fourth layer appear, we're in what stage? Or in bell stage, what will happen? That's the main thing that will happen. Okay, let's move on. So far we said we have the enamel, the dentin, the pulp, and the cementum, and we're trying to find out where each one of them come from. So far we know that the enamel came from the inner enamel epithelium by making the being made from the ameloplast. So we got one of the tooth layers down, right? We got that down. Now let's see where the dentin come from. So this is the inner enamel epithelium, right, layer, and this is the outer enamel epithelium layer. What's inside between the inner enamel epithelium layer by itself, like inside of here, we call it dental papilla. And remember, it's not dental lamina. Dental lamina is the main thing that got all this started. Okay? The dental papilla is the one that actually makes the odontoplasts, which are the cells that make the dentin, and technically they would make the pulp, because that will be the hollow or the empty space, surrounded by the dentin. Remember, the inner enamel epithelium, which is this one, this layer, made the ameloblasts, which are the cells that will make enamel. The dentinal or dental papilla is the layer that will make odontoplasts, which are cells that make dentin. Okay, so again, you should know what cells make dentin, what cells make enamel, and what layer, what part. Again, I can ask you, like the dentin is made from, would be the dental papilla, or so on and so forth. Anyway, the other one is the dental. So far we know where the enamel comes from, which is the inner enamel epithelium from the ameloplast making the enamel. We know where the dentin and the pulp come from. So the dentin from the dental papilla, making the odontoplasts that make the dentin, and the pulp is made from the dental papilla, mainly because it's surrounded by the dentin. Okay, now we need what more? We need the cementum, right? So the cementum is made by the dental sac, and the dental sac is that these cells that surround technically the dental papilla, right? So this, again, because this would form the crown part and all of that, and this will start going down to start forming, along with other ones, will start forming the root part in a way and the cementum. So dental sac, by the way, is also known as the dental follicle. Okay, so cementum, periodontal ligaments, and some of the alveolar bone is made by the dental sac. And by knowing all of that, now we know each layer of the tooth is made from where on how, right? Enamel from the inner enamel epithelium, dentin from the dental papilla, and cementum is from the dental sac or the dental follicle. Okay. Now, other parts of the dental lamina, which I already talked about in the first picture, the successional lamina, which is this one here, right? And again, know these pictures, you'll be able to recognize these things here. The successional lamina is the one that makes the permanent teeth, and it appears, or extend lingual to each of the to each tooth. So you see, this is the enamel organ for primary tooth, and this technically is the successional lamina that will start forming and will form same stages. So we'll have also an enamel organ here that will start to erupt and all of that same thing. Okay. Permanent molars, as we said at the beginning, they're non-successional or non-succedaneous teeth, because they appear on areas that did not have primary teeth. Because we know the primary teeth are 20 and they don't have the premolars, but the permanent premolars would appear in the primary molars area, and the permanent molars would appear in an area that is empty. So that's why they are non-successional. The other type of the dental lamina, or the other part, is the vestibular lamina. And again, I talked about that. And technically, this would make the vestibule. But as you can see, they would appear to the facial and buccal or buccal direction. The successional lamina to the lingual, and the vestibular lamina to the buccal or facial. And that will form the vestibule. Again, I'll go just back here to this picture. So this is the vestibule that is made by the vestibular lamina. This is the successional lamina that will form the permanent teeth. And as you can see, the molars don't have the primary enamel organ. Okay. All good. Now, we're going to talk a little bit more about the root formation. So kind of now we know how the crown forms, all of it. So the enamel is made, the dentin is laid down, and we know how the cementum will know. Let's get to know a little bit more about how the root would form. So I got this part from chapter 21 because I think it's better to put it here, since we've been talking about all these surface, all these layers, and they're related to them directly. So, but chapter 21 also, we'll discuss it. Also, it's part of the test. It has other information. So this is just part of chapter 21. So the root formation, so it begins after the crown outline is formed. Like we have a crown outline, that's when we start having the root, right? But before it is calcified, before it's completely calcified. So how will this happen? Remember the layers that we have? We have the outer enamel epithelium, the inner enamel epithelium, right? This is the inner, and that's the outer enamel epithelium. When they meet together, they meet in an area that we call a cervical loop. That's the point where they meet. So this area here, technically, when they start to meet, this is called a cervical loop. That's the cervical loop. That's the area, technically. Okay. When they meet together, they will start going vertically down. Okay. And then when they do that, when they go vertically down, the thing that they will make, what we call now, we'll call it a root sheath. So the outer enamel epithelium and inner enamel epithelium meet in the cervical loop. They start going vertically, right? And that will form the epithelial root sheath. The actual epithelial root sheath, or we can say also outer enamel and inner enamel, start moving horizontally and kind of inwards, and that will make the epithelial, sorry, this line should go all the way here. This line would make the epithelial diagram, this movement horizontally, the epithelial diagram. Okay, so the root sheath by a vertical growth would determine the root length, and the epithelial diagram by horizontal growth would determine the numbers of the roots. Okay, so this is the main information about this. We just added now one more kind of layer or two more after the outer and inner meet together in a cervical loop area here in the bottom. They would form the epithelial root sheath and the epithelial diagram. The epithelial root sheath goes vertically and determine the root length, and the epithelial diagram goes horizontally and determine the number of roots. So if you take a look here, technically the epithelial, see, this is the epithelial root sheath going down, and this is the epithelial diagram going horizontally. So if we didn't have any, going horizontally in a way, there will be just one. If we have like separation, we might have 2 or 3 roots, and so on and so forth. Okay, this is just another picture that will show. You don't have to recognize all of these pictures, just the other ones that I talked about before. So this is the reduced enamel epithelium, and this is made by the outer enamel epithelium and the ameloplasts. When they get together, they would form the reduced enamel epithelium from the outer enamel epithelium and the ameloplasts. That's the enamel space. Technically is made by the ameloplasts. This is the epithelial root sheath, and these are the ones that are made by the inner and outer, right? And this is the epithelium or epithelial diagram, again made by the inner and outer enamel epithelium, going horizontally. This one's going vertically. Yeah, just same things. This is the dental sac, or also we call the dental follicle, right? And this is what will make the cementum, the periodontal ligaments, and some of the bone. And you have the dental papilla, which will make the dentin and the pulp. Okay, again, this chapter needs a little bit of more focus than other chapters, and hopefully this helps. And that's the end of this chapter.